Today we're going to be talking about bronchopulmonary dysplasia. Group members are Freddie Hugg, myself, Kim Kraft, and Jamie Fichter. Bronchopulmonary dysplasia is a long-term pulmonary disease affecting newborns with respiratory failure and/or those dependent on oxygen therapy or mechanical ventilation. Due to the newborns being dependent on ventilation, the bronchial epithelium is damaged. This damage makes it harder for the body to defend against inflammatory cells invading the airways. These invading cells lead to edema in the airway, causing alveolar cells to become thickened. The continuous use of oxygen affects the developing alveoli. As a result, atelectasis and cystic areas develop. This predisposes the infant to pulmonary hypertension. The lung's ability to remove mucus is decreased due to a loss of ciliated cells. This will eventually lead to pneumonia, mucus plugs, and/or atelectasis. Diagnostic tools for bronchopulmonary dysplasia include X-rays, blood tests, and certain signs and symptoms, including pallor, weight loss, poor weight gain, labored breathing, retractions, prolonged exhaustion, tachycardia, tachypnea, wheezing, restlessness, and irritability. These signs and symptoms will be further discussed on the next slide. Nursing diagnoses we came up with for bronchopulmonary dysplasia include risk for fluid overload, impaired gas exchange, imbalanced nutrition, and a risk for infection.
Manifestations of BPD include pallor, weight loss or poor weight gain, labored breathing, retractions, prolonged exhaustion, tachycardia, tachypnea, wheezing, and restlessness with irritability. Pallor is caused by hypoxia and activity intolerance. Weight loss or poor weight gain is related to poor feeding and increased metabolic workload as a result of the condition. Labored breathing, retractions, and prolonged exhaustion are due to breathing difficulty as evidenced by the use of abdominal and accessory muscles. Tachycardia and tachypnea are due to reduced oxygen level. Wheezing is associated with an overactive airway and puckering of the mouth along with flaring of the nares. Restlessness and irritability are caused by breathing difficulties. Crackles and decreased airway movement are other manifestations of BPD. There is going to be continuous treatment for the newborn with BPD. The treatment will consist of nutritional therapy, medication, and oxygen therapy. Regarding ventilation, it should be discontinued as soon as possible, while ensuring this is the safest patient measure. It should be discontinued as soon as possible because tapering from ventilation is proven to have a better outcome for the patient. Lowest inflation pressures should be used while on mechanical ventilation. Oxygen therapy will be a necessity for outpatient treatment. Nutritional therapy, medication will need to be implemented in the newborn's plan of care. Additional calories in feeding plan will be a requirement for the newborn care. This is because the extra calories will assist with the newborn's lung growth and repair. A calorie intake of about 150 kcal per kilogram per day to produce a weight gain of 20 to 30 grams per day is an appropriate goal. Triglyceride, oil, or glucose polymers added to an already high calorie formula can aid in meeting the newborn's calorie needs or caloric needs. Human milk is the recommended nutritional source for newborns for at least the first 6 months of life. Unfortified human milk may not meet the needs of the growing preterm. Human milk fortifiers contain varying amounts of protein, carbohydrates, calcium, phosphate, electrolytes, vitamins, and other minerals such as zinc, magnesium, copper, and manganese. Many medications are given to infants with BPD. Diuretics, such as furosemide, are indicated because fluid overload and edema can put additional stress on the heart. A diuretic that is administered once an infant can tolerate enteral feeding. Potassium chloride and calcium supplements should be administered when the infant is given a diuretic due to how it affects the fluid electrolyte imbalance. In the early stages of BPD, an inhaled bronchodilator, such as albuterol, is indicated to decrease the lung damage and airway resistance. To enhance lung compliance, the respiratory status theophylline caffeine should be given to relax smooth muscles. Palivizumab is recommended to prevent respiratory RSV in children.
For oxygen education, the tank should always be in an upright position, should be kept at least 5 feet from flammable sources. No one should smoke near or in the home of the child, and alcohol-based substances should be avoided. A fire extinguisher should be in the home. For resources for the parents, they should be referred to social services for financial assistance on BPD. The parent should also be informed how to perform certain activities before discharge, such as playing, bathing, holding, and feeding the infant. Some outcomes is the most infants improve over time. They may or may not be on continuous oxygen. Most likely they will be. There is some negative outcomes to this condition too.
Which of the following are not symptoms of a child diagnosed with bronchopulmonary dysplasia? Select all that apply. A. Weight gain. B. Flushed skin. C. Restlessness. D. Substernal retractions. The answer is A and B. Weight gain would not be seen in BPD. Weight loss is a manifestation due to the workload of breathing. Flushed skin would not be a manifestation of BPD. Pallor would be present due to an inadequate amount of oxygen. Infants with bronchopulmonary dysplasia are commonly treated with diuretics such as furosemide. Which of the following outcomes are expected with this medication? Select all that apply. The answer is A, B, and C. The purpose of a diuretic is to reduce edema and in return decrease blood pressure.